To start with, it was a very anxious moment when I realised that I'd be assisting on patients with special needs. Just from the simple fact that I'd heard different things, they would be very difficult to deal with, that it would be a boring situation to be in because of the length of time needed with the patients.
You just have a patient, like any other patient, and you just work around the issues that they're having, be intellectual disability, be physical disability, be whatever it is, you just work around it.
What you start feeling, the first challenge is, hey, I don't think I can do a perfect job in this mouth. I don't think I can handle it. And then you start feeling, hey, am I not good enough? Then you start feeling challenges within yourself and start answering yourself. But I think it's just a matter of growing out of it. It's a fear, anxiety, and an emotional state which we have to overcome if we want to help that population there.
We know that someone with intellectual disability has got 7 times more susceptibility to develop dental disease. Unless someone has got very tuned carer who knows exactly their behaviours, it might go unnoticed. The disease will get unnoticed until it's actually in its later stages. So they depend on us, the individuals with special needs depend on us as professionals to find out the disease rather than them complaining like you're an average person.
Hi, I'm Warren Schneider and I'm a specialist in special needs dentistry. I didn't start off as a specialist. I was very green in my general practice, and when I first took on special needs patients, it was through the mentorship and guidance of people that were surrounding me. They showed me some tricks and some skills on how to deal with special needs patients and the issues and challenges clinically. I wouldn't have got anywhere in my special needs career if it weren't for my mentors, and I learnt a lot from them. The overview of today's presentation is actually to give you some tips on and ideas on how to treat patients with intellectual disability. It's just to demystify the whole process. We want to also look at the role of the carers and people who are advocating for their treatment.
Warren's just going to wash his hand and put some gloves on, okay?
To get a really successful visit really requires successful preparation. In that preparation, you've really got to ask a few questions. It's not just, can you come at 4:30 on Wednesday? You've got to say, are there any medical issues? Are you taking any medications? Are there any access issues to the surgery?
Good morning, Community Health Centre.
And who's going to advocate and sign off on the medical consent?
Oh, hi Pam. My name is Monika and I'm calling on behalf of Brian Campbell. He needs a dental appointment.
Is this his first visit to the centre clinic? Yes, it is.
First available would be with Dr. Adam Peters
On Tuesday week.
Brian has an acquired brain injury and can get quite anxious, and he prefers to see people or dentists that's female.
Is that possible?
Yes, Dr. Kerry Punchin could see Mr. Campbell on Wednesday week the 19th if that suits.
Yes. What time would you prefer?
Mornings are preferable.
The earliest would be 11.
Nothing earlier?
Not at this stage, but I could call you if there's a cancellation.
That would be great, and if it's okay, I'll call an hour earlier just to make sure Dr. Punchin's on schedule.
Just to avoid any anxiety on Brian's behalf.
Good idea. You mentioned that Mr. Campbell has an acquired brain injury.
Is he able to consent to the treatment on his own behalf?
Yeah, he can consent for himself.
If Mr. Campbell is able to consent for himself,
We won't have to contact the next of kin. Thanks, Monika. We'll see you and Mr. Campbell on the 19th.
Okay, thanks Pam. Bye.
The other contact that I really need to be in touch before I can see my patient is actually the medical practitioner. The information could come in a written format on the application form, and usually I would need to look at that before I see my patient. And if there's anything that is unclear, it's highly recommend that I would contact the medical practitioner, that be the general practitioner or a psychiatrist, a psychologist, a specialist of any sort, and get more information. And once all this valuable information are there, it's very important to put them into the documents in a very clear way. If I'm not here, another clinician picks up this information, they've got all the information there to arm them, and they're ready to go through with that patient without having to ask the same questions again.
Start just having a look in the mouth. or just making them comfortable in the chair so that they give you a high five when they leave the chair. That can induce a bit of confidence in you as a clinician, and then comes a step 2, then comes a step 3. So nobody expects you to jump on step 5 to start off with. Just step 1 would be good enough. Just let the door open up first.
In this scenario, we'll be seeing Kerry, who will be treating Brian, who has a complex mix of mobility and communication issues. And by the way, the people that are playing the patients today are actors that have come in to do that role.
Here we go, Brian. Now we're just in the dental surgery that we're going to be seeing you in today.
If you've got a patient that's had a brain injury, sometimes that person is going to be a little bit more confused than they may have been otherwise. They may be a little bit slower to understand and take in what's being explained to them. So you've got to give the person time to process what you've told them and take it on board.
So Brian, what we're going to do, we're just going to move the chair around here a little bit further, and then we're going to see if we can get you across into the chair. So we'll have a look at your teeth and give them a good check and see what's happening with those gums you're having trouble with.
There'll often be a situation where a patient initially may be reluctant to sit in the dental chair.
Be really brave for us.
No.
No? Okay. Look, Brian, the reason that we pop you in the chair, it's really just so it's more comfortable for you.
And you're really
or
just
as well
trying
as
to
for me as
demystify
well, but
whatever it
it
is
means
that this
you'll have
person is
head
worried
support,
about,
not looking too
so that they
forward.
can see what it is, they
You're
can
rather
see what
worried,
it
in fact.
does, and
Do you not-
it
you
won't
don't
be
think
such a
you'd be able
strange
to
and
move
unfamiliar
the
thing
chair?
next time.
What if we have a look at your mouth and just you can stay in your wheelchair, but we just have a look that way? Do you think that might be better? Can you manage that? Yeah. Look, we'll just take it slowly, and you'll be
You've
fine.
got to
okay?
give the patient some feeling of control over what's going on. So they may want to choose whether they're going to be seen in their wheelchair or whether they're happy to transfer into the dental chair. You would have an intention of gradually introducing things to the patient so that over time they would become more and more comfortable with what would normally happen in a dental situation. But initially the focus is more about making the patient feel comfortable and at ease, and to have an experience of success, that they've come to the dentist and there's been a successful
Shine in
outcome.
your mouth so I can get a good look, and we'll have a look at your teeth and gums. And
Some patients will just sit in the chair and open their mouth. Other patients need a lot of explanation as to what we're going to do and how we're going to do it. Strategies that help in that case is more about getting the patient to relax. If they're very tense, it might be getting someone to hold their hand or massage their shoulders. I sometimes ask patients to take some slow, deep breaths in and out just to help them relax a bit more.
Clean and tidy while we're having a look. Now, the next thing
One of the things I've learnt working in special needs is just to take things very slowly, step by step. I may not start with dental instruments. I may start looking in the patient's mouth just with my hands or with gloved hands. I may start with a toothbrush and just gradually introduce things.
Now just relax your lips and cheeks a bit. That's right, just relax.
Talk to the patient
Now, what I'm
about, well,
doing
what
here
we'd
is I'm
like
just
to do
having
next time. How do you feel if we do this? Or how about if we try that? They go away and it's a positive experience. There is a little bit more trust. They are a bit more willing to try something that they may not have been keen to try in the first instance. It's just such a positive feeling, seeing them feel more confident and more comfortable and happy to come to the dentist and have regular care rather than just being seen once in a while. It's a fabulous job.
When you have a patient with special needs, it's a good idea to say, hey, you have to make sure that everything is safe for people in the clinic present, because you're the clinician and you have to make sure. You have to communicate very well with your assistants there, that what you are going ahead for and what is your intention, so that she can assist you in creating the environment.
Us clinicians could tend, to get too involved in what's happening in the mouth, but my dental assistant always is tuned to what's happening in the room. If she feels, the knuckles are getting a bit tense or white or whatever, she'll always, draw my attention to that.
A lot of the times it is the DA who is communicating with the carers about explaining paperwork to them, what it is that actually needs to be the next process in the treatment, and also just organising appointments. There's a lot of different factors having to that are involved bringing a patient with special needs into a clinic.
Treating people with intellectual disability is much the same way as you might treat somebody with a periodontal need or endodontics or need orthodontics. You just start with the really simple things and work to a higher level of skill. What you want to do is actually place yourself in the chair with the patient, have that empathy, see the treatment from their point of view. And that means you get an insight into their anxiety about the procedure. Improving their dental health and their oral health will have knock-on effects to their general health and their mental health. And at the end of the day, they have a legal right to access treatment as much as anyone else does. Some of the issues faced by patients include advocacy, consent, access. Financial burden is also a consideration. Who's going to actually pay for that treatment? What about the anxiety of the carers and the family members themselves? Anyone can be anxious when they go to the dentist.
Carers help you interpret those physical movements which might not mean anything to you but might mean a lot of communication, has a lot of communication value. So it's good to have the carer around to explain you or help you making a decision what's going on there.
Without the carers, a lot of the times they either can't be brought into the area that you need them, and they don't understand what's actually going on, and it's also a comfort factor for them as well to have their carer with them. The dental team and the carer and the facility that the patient is in all need to be on the one page with what's going on.
Be a family member or a paid carer, they know that person much better than me. So, I need to find from the carer, I always ask that question, what is it that they like? What is it that they don't like? And what can I do to make it easier? What do I need to avoid? I'll give you an example. A patient with autism, we do an interview over the phone before they come in because that could be invaluable. If someone with autism, they're very fixed on their likes and dislikes. So if they don't like the color pink and they don't like females, don't make an appointment with a lady wearing a pink coat. May have a male clinician, with a blue coat or whatever. Make sure they know the subject of interest so you can keep them occupied and they'll be happy.